everyone to our COVID-19 webinar series. This is our 23rd webinar in this series. Today we're talking about COVID-19 Wave 3. So we're going to have an update, talk about advocacy work and what is next. And so this is our agenda. Doris, Dr. Doris Grinspun, RNAO CEO, who many of you already know well, is going to lead us through this discussion of the update, the advocacy, and what's next. And we will have plenty of time for questions and answers, and then some calls to action, what we're hoping that you will help us with. And this webinar is being recorded, and it's going to be posted on our COVID portal. So if you haven't reached our COVID portal yet, we encourage you to go there. There are lots and lots of resources, including all of the recorded webinars that we've had in this series. Today, please use the chat box for your questions and your comments, and we'll do our very best to keep up to date with those questions and answer as many as we can. And we can also unmute lines later on in the call, but right now everyone is muted so that we have a crisp line. So all of our information is updated regularly on the RNAO portal. So please visit the portal at rnao.ca. So Doris, I'll hand it right over to you for updates.
So now that I need to tell you that we are on wave 3, but yes, to tell you that RNAO unfortunately did predict that several months ago, and including when the Premier lacks the measures, the public health measures we said wrong thing to do, we will no doubt move into wave 3. And now, even before epidemiologists, and again, I'm sorry that we are predicting, but we will fall from wave 3 to wave 4, unless the Premier restricts much stronger the movement of people. We still see lots of people in the parks gathered without a mask, as if nothing would happen. The numbers in ICU, as you know, today have increased yet again, 600 people in ICUs. The number in the province is approaching 4,500 new cases, yet again, today and yesterday. And yet the vaccination rollout is not even reaching its own target of 100,000 per day. Yesterday was about 70,000, with 800,000 vaccines last night in the fridge. In my next blogs, I will post for everybody the vaccine tracker. It is a vaccine tracker of when the province gets vaccines and when it's delivering them. And what is most puzzling to us is the fact that we are not fully utilizing primary care, not doctors and not nurses. And we are not fully utilizing, or at all utilizing, home care, which the agencies are ready to go out and deliver, both in the homes of people, to go to warehouses, to go to food processing plants, to go to vulnerable communities, to go to teachers. I need to tell you, I got my vaccine yesterday, well, Saturday. My gosh, I never got so many retweets to any tweet as that one, with tons of congratulations, etc. What I didn't share there, which I'm not now looking more in depth, is why did I get the vaccine from a doctor when actually every other year in that clinic I get it from a nurse. They have plenty of nurses, and yet I got it from a physician. And that's not to say that I didn't get a good shot. I got a wonderful shot, but as the physician told me, why is it that the senior physician is here delivering vaccines? I don't know. I don't know the answer, but trust me, we are looking into that. We know that not all NP-led clinics have even received vaccines. So we are looking in what's going on, either in terms of the logistical problems again, or something deeper with some type of agreement that doctors participate more than nurses. Not that doctors are not important, but we need to have all hands on deck. We already approved that paramedics that never did vaccination before do vaccination, but we have 20,000 RNs working in primary care and in home care not being utilized. And quite frankly, this is in part why our emergency departments are bursting at the seams, and also our ICUs. There are two ways of curbing this virus before it's too late because of the other variants of concern. One way is the public health measures to restrict movement, including and up to a curfew if that's what's needed. If people cannot behave by themselves, which obviously they are not, as we can see. And the other is to vaccinate, 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 and vaccinate more, because that prevents people from, at the very least, get very sick and going to and dying from the disease, and also overwhelming the system. So that's where I want to start, because I want to leave you with the impression that this was and is preventable. This is not that you need a magic wand to make it go away. What you need is strong public health measures that are reinforced every single minute of the day, and vaccination, vaccination, vaccination. And we are saying way more than the 100,000, and we're not even reaching 70% of that. So we need more and more and faster because of the variants of concern, specifically the one from, thank you, Susan, the one from South Africa, which is increasing in Ontario, and the one from Brazil, which is increasing in Ontario, because those are even faster in reproducing, faster in spreading than the UK one, which already is faster, as we know, than what's called now COVID classic, you know? So we need to absolutely fasten public health measures and vaccination. That's the way to deal with it, not just creating more beds and more beds in ICU and assuming that nurses will somehow, you know, reproduce like the virus to be able to care for people in ICUs. We need to prevent the influx of people into ICUs, not by telling them, which I hope will never happen, sorry, we cannot take care of you because you are not, you know, sick enough, as it happened, as you know, in Italy, but by actually preventing the influx, because we are very strong with strict public health measures that get reinforced using all the available tools that government has, including, and that might happen, not going back to school, not only in the next 2 weeks, but not anytime soon if this continues this way, which is tragic, as you know. We as nurses and RNAO want the schools open. But if we cannot lessen the burden on communities, especially on vulnerable communities, which are the people that end up the most in the ICUs, we will need to keep the schools closed. And that's a tragedy in itself, in addition to the tragedy of having people with so-called elective surgeries being canceled. I mean, yes, the minister said a person with a heart attack will be accepted. Well, of course, that would be imagined, if not, right? But what about a person with heart conditions that needed to be attended to? What about a person with cancer at a very early stage? Well, I am very afraid about that, because by the time that we will look at that person with that heart condition, that person with that, you know, beginning cancer, it will not be so beginning anymore. And that's tragic, because this was and is preventable. Please do not believe when you hear, whether in the media, politicians, or people in the public, we didn't know any better. Yes, we did. We did at the beginning of this pandemic, because we had an RNAO warned right in January about what's going on. And RNAO is warning now that P1 and also the South African variant, and who knows what other mutations will take over more and more unless we act now, because we are still paying the price of the last holiday where people gathered because the restrictions were not put in place. And we all know that that is the result. You see the result 10 to 14 days later. And no, we do not need to wait until the modeling proves itself in an ICU, like our Attorney General, Minister Sylvia Jones, who I respect immensely, but please, Minister, do not speak this type of talk in the media, because it only confuses the public. We do not do modelings to actually then see that they materialize in an ICU and then we act. We do modelings to prevent the disaster that we are experiencing. Plain and simple. Next one, please, Susan. I'm sorry if I sound frustrated. I am frustrated. And I am frustrated because Ontarians are frustrated and because our colleagues, your colleagues, and my colleagues of almost 200 people today here, actually we just surpassed 200. Your colleagues and my colleagues are toiling in the ICUs of this province every single minute, desperate, exhausted to no end, and so are the intensivists. The first round and the second wave were long-term care, now the tragedy, and it was preventable too, and now the tragedy is in our own ICUs, and that's a tragedy that if we don't get hold now, it means it will only get worse. So yes, we are upset, and we will continue to be upset until we see every single nurse in this province, those 20,000 nurses that work in primary care and in long-term care, being fully used to vaccinate, fully used to vaccinate. And we all need to insist, and I plead to you to get into social media and to retweet RNAO's tweets, to retweet the tweets of the gritty nurses, the tweets of Brigitte, the tweets of there is a new one by our colleague Deb Lefevre called 2 RNs and a dog. People are frustrated and you all need to be tweeting and retweeting. As long as you don't say the name of a patient, tell what's the story, because that's what it will take to see action. And it's unfortunate because action should happen without all of that. Next one, please. Today in the evening, there is a very important town hall that we were asked to promote. So you have it here in front of you. And please attend it. This is to vaccinate people and to answer to questions with minority communities, or what I prefer to call them, diverse communities, the communities that enrich us all. There is a very important town hall. Please attend it. It's for the people that live in the area of Scarborough, but I believe that the program of decreasing vaccine hesitancy and increasing people from coming to vaccination places, people 18 and older, is for all the communities that you see in the flyer and anybody else, because you actually can learn, all of us can learn and all of us need to learn to help people get vaccinated as soon as possible. So we will take picture of that, please. Do attend. Do tell your family members, friends, colleagues to attend, because it's via Zoom, of course, and it will be very, very informative and very important. And if any of you can help with this initiative and want to volunteer, or I don't know what the arrangements are, please, if you can send the name to PG and PG, or to Susan. Susan, if you can put 2 emails where people can send the names to where to send if they want to help with the initiative of vaccinating people, then absolutely get involved and we will connect you with the person that is organizing this. Next one, please. And I know there is a question. We will stop in a minute. Maybe let's stop here for a minute, Susan. Let's ask the question that I see posted there. Or you want me to go to the end and then you look at all the questions? Your call, Susan.
Well, Linda's had her hand up for a little bit, so maybe we'll have Linda's, we can unmute Linda's line, and then I'm just gathering some questions in the chat box too.
Someone made a comment, I am concerned that we are going to start to look like New York and Italy. I share your concern, and I do not think we should let down of our concern until we see the action required. And as of today, as of an hour ago, I still do not see the home care agencies. St. Felice is ready to go. VON is ready to go. Bayshore is ready to go. And I know that any other home care agency will be ready to go The nurses are going to the homes of people. 7,500 nurses, guys, work in primary care. Every day they're seeing patients. If you are a nurse that are seeing a patient at home, it's because that patient cannot be seen somewhere else. So those patients should be vaccinated. Those nurses are moving from place to place, believe it or not. Nurses in home care still have not been vaccinated themselves, the great majority. So we have been pushing for that as well. And that needs to happen because they go from home to home to home to home, as you know. That's the model that this province set up, many years ago. And that needs to change too, but we will not talk about that now. And let me say to you another thing that we will talk, and we will talk measured at this point, simply because we need to focus now on solving the problem. But let's not forget for a minute that Ontario is the lowest RN per population in this nation of ours. Let's not forget that RNAO issued a report in 2016 called Mind the Safety Gap. This is what we are talking. The problem we have in ICUs and in hospitals in Ontario is because for a decade or more, we have done RN replacement. I'm not going to pound on it now, but I already said it to the media, and we will continue to push at that, the same as we are pushing the issue of long-term care and the need to do the nursing home basic care guarantee. And it may come to the point that RNAO will be asking for an inquiry into the issue of ICU and human resources, because we have been talking for 10 years about this. And every year we go down on the RN per population, let alone not up. So let's not be surprised about the atrocious situation we find ourselves now, on top of the issues of public health measures not being sufficient and vaccination not rolling out quick enough.
So I think Linda's ready to speak. Go ahead, Linda.
Thank you, ladies. Appreciate it very much. Hi, Doris. Hi, Susan. You hear me? Right?
Yeah, we can hear you.
Doris, as two of us wrote in the questions, don't be afraid of that frustration of how it's taken its form. The rest of us, or at least I will own that, been feeling like this for several months. And I too, when I asked the designation of the person who gave me my first shot, was a radiation oncologist.
You explained to me why, right? And what fee they're being paid?
I don't know.
Versus Linda, the fact that nurses are already in the payroll. You wouldn't even pay extra.
I'm ready to retire, and I'd like to do something good for COVID on the way out. And I'm looking at a radiation oncologist on a Saturday. Lovely needle, I agree. I just was really surprised that could she not be seeing patients more appropriate to her skills and talents? So
and mine was, as she said to me, I am a senior family doctor. Why am I here on a Saturday? Because I asked her. First, I got the shot. I asked if I can take a picture, which I tweeted. I forgot to let my hair down, my long COVID hair. And then I said, can I ask a question? And I said, it's the first time that I get a vaccine from a doc, not from a nurse. Why? And she was first a bit shocked. And then she said, and I am a senior family doc. Why am I here on a Saturday? Well, it's something that needs to be looked at.
My thinking is that despite the advertising for RNs between South Lake, RVH, any of the number of the area hospitals, is these are their staff people they've already got on board, and some have said, I'll come do it. Others have said, let's just keep our own people doing it.
Well, be careful because they're being paid.
I get that. I'm not sure why they're advertising all around and building a group to do it, but they're not calling anybody. I started last September. I'm still waiting. I find that very,
I think,
very
Susan,
real.
That we may do another session next week and invite the media to hear these comments. Well, this will be posted. Let the media ask those questions because you, like you, many others have offered even in the social media, I'm ready to go and vaccinate people, yet they're not being used. And my fear is we will start to hear the same from ICU nurses, and again, they're not being put to use.
And further on the same point, some of the news coverage that I've seen and the techniques that have been used by whoever's giving them and EMS and whoever the other folks are that have them is a practice issue for me. I've seen people letting go of syringe while changing hands. I've seen people crossing arms to go to the hazard box. I've seen them given in a place that I wouldn't call the deltoid muscle. I've seen them doing it at a non-90-degree angle because they're standing up and look like they're doing arabesques. And I've been concerned, and I have a note in my calendar to call the college, and I'm not sure where the practice leaders are in the techniques that are being given. Bless their hearts, I get it. And it's not purely a complaint form, but when I'm sitting in my living room going, what are we doing here? I find that a very big concern, and yet I have heard zero about it on any front.
Yeah, so thank you for sharing. I want to read this because I wanted to get into the tape message for the sake of the minister and for the sake of Ontario Health and for the sake of Catherine Brown, who I understand coordinates the issue of human resources in ICUs, and also for the media. So this is the nurse Anita, and she says, how do I help? I am a trained ICU RN, currently working in public health, sitting here at home on my days off when I could be helping in hospital. It's so frustrating. Thank you, Anita. I have seen your teeth on that. I am going to pass it to a media because I will ask them to interview you because I don't know what's going on. Either it is logistical problems as we had during the first round with nursing homes. It took months until RNAO was called to actually coordinate with Via Nurse. By then we had already staffed 150 nursing homes ourselves with Via Nurse. I offered to trigger again Via Nurse for ICUs. I am yet to wait to be asked. So let's move on to the next, please.
Doris, if I just might, I'll keep it short, but it's related to the press issue. I just read in Canadian Health Network kind of an op-ed by one of the physicians about her comparisons to what she was putting up with safety measures with her daughter and calling the article On Stupidity. An excellent article, absolutely correct. And I was concerned because I thought if I write an article like that, I'm going to have a little call from the college by tomorrow about unprofessional behavior. So I was kind of clear. I've always been concerned about writing papers or writing op-eds or...
Thank you very much, Linda. We will move now because we have a lot of people that want to make comments.
I get it. And if you could include that in your questions. And I appreciate it. Thanks. Bye-bye.
Take care. Thank you.
You too.
Susan, what's next?
Sure. So we have questions about like lack of clarity around where to actually, and inconsistent information about where to actually get the vaccine, that, you know, that it's available for those 18 and older, for some vulnerable communities, for teachers. So do you have anything to say about that, about the, you know, getting more clarity around where
on the priority? So there are two priorities. The first one, as we know, is age, has been all along because 60 and over, the mortality rate is higher, that's why. And the older, the more, okay? And second is the issue, and they're using for that postal code now, is the issue of basically social determinants of health, right? People that are on precarious employment, that are on minimum wage, that can usually not take a day off to get the vaccine, and that live many times in multi-generational families, putting everybody else, not only themselves, at risk. And then, of course, the third one is teachers, because the issue of schools. Now, what we are saying, given that people cannot take the day off, and no, they don't have sick times to go and get the vaccine, by the way, they have sick days if they are sick, if they have symptoms of COVID. not to take the vaccine. So no, they cannot take the day off to take the vaccine. And even if they could, we need to facilitate, and we're saying bring the vaccines to them. East Toronto yesterday did a fabulous pop-up clinic with Michael Garon and with others in the community for, it was all over the media, it was excellent. They did over 1,000 vaccines of people. That type of initiative should be multiplied by 20,000 in all the communities in need, in all the burdened communities, burdened by social determinants of health. And second, we absolutely need to get the vaccines to the sites of warehouses, to the sites of food processing plants. And we should bring them there and with people that can also engage in conversation. So there is less, you know, if there is any vaccine hesitancy, that people can engage and see themselves in the person speaking, see themselves with people that have gotten the vaccine, that, you know, can speak their language, can talk with them, and can alleviate some of the worries that people may have. The article that Liz Brown wrote yesterday night in the Toronto Sun, and I will put it there. It's very good. She asked me about what should we do with people that have vaccine hesitancy. I said, well, the first thing is to understand their histories. If they had, you know, experimented with your ancestors or your grandparents or your parents in whichever way or shape, and yes, this did happen, of course, as you know, with Indigenous peoples. This has happened with the Black community. So you need to engage where people are to help them alleviate some of those concerns and fears. So that is very important. And we need to therefore both bring the vaccines to the sites, to the work sites, and also bring influencers that can engage with people to facilitate the conversation and have as many people. My gosh, if in each one of those places we could aim to 100% vaccination. Let me tell you, we heard from Maycat, our guru on Indigenous peoples, a nurse guru. And she told us about what happened with the non-community. She believes, based on what she has gathered so far, and the minister already has the real stats, but we don't, that is close to 90%, if not 90% of people who are vaccinated. Imagine if we can get all of our vulnerable communities vaccinated at a 90%, how much suffering we will save from them, how many lives we will save for people in their own communities, and how much we will be able to defeat this nasty, nasty, nasty virus together.
Hey, Doris, I'm just going to group a couple of questions about
Yes.
vaccines. So,
oh, and I do want to say, over 4,000 people signed the action alert that led the premier, amongst other things like the doctor's letter and 3 chief medical officers of health, Dr. Law, who deserves a medal because he went alone on a limb first and has gotten a lot of flack, unjustifiable. Dr. Eileen De Villa and Dr. Vera Hatches, the 3 of them also sent a letter, of course, to the premier that they were going to move, whether the premier did or not, asking him to move. And these 4,000 signatures, which happened at the time that, just so you know, cabinet was in session, certainly helped. The timing and the signatures help immensely to have the premier take tougher restrictions, and those restrictions may not be enough. We are monitoring, and we may be asking for more. Yes, sorry, Susan, I wanted to thank people.
yeah,
so they know the impact of their signing.
sure. Yeah. So there are lots and lots of questions, Doris, and some that were submitted before the webinar. And we also have a couple of hands up. So there's lots of interest today. Just a couple of questions I'll group. So asking about the current status of vaccine supply and maybe talk about Dr. Homertian, who is going to be taking over the rollout plan. Can you speak to either?
Yes, and I will send you in a minute when you ask the next question, the vaccine tracker, so everybody can see in the future, because the vaccine tracker, the Canada vaccine tracker, it shows you when they got the supplies and how much was given and the difference on what's in the fridge. So right now, as of last night, there were 800,000 vaccines still in the fridge. On the weekend, they vaccinated on Sunday 70,000 and change. The goal was 100,000. I'm not sure what's the glitch or what's the excuse. My hunch is engage all the primary care nurses, all the primary care docs, and all the home care nurses, and you will have no glitch. They will be vaccinating 24/7, which is what we should be doing. And then in terms of Dr. Tien, I have sent in every tweet that I speak about primary care and home care, I engage him. Do the same because it's very important. I mean, he's the one that led the initiative in indigenous communities with NAN, and they did a fantastic job. So let's hope it will go better here. But so far, we have not seen sufficient movement, I must say. We have not, in terms of vaccinating on site in warehouses, vaccinating on site in food supply, food processing plants. We have seen more pop-up clinics, and we need a lot more of them too.
Great. Doris, I want to ask a question that was submitted in advance about policies. So what happens when a nurse who refused to get vaccinated comes into contact with vulnerable patients? Do you see that as malpractice, or do you have any comments about that?
So it's not malpractice, because being vaccinated is not mandatory at this point. It's not mandatory. I think it's the same question as with the flu season, right? Except that now everybody needs to wear a mask. So for now, it's not an issue. But if the day will come when not everybody needs to wear a mask, I can tell you at RNAO, we will demand that if people have not been vaccinated, they wear a mask for any foreseeable future of years to come. We are not going to take any risk, because you never know, first of all, if the next winter, this will pop up again with some other mutation. You know, people, of course, have a right to their own beliefs, values, etc., but they do not have a right to put others in danger. And I think this is the opportunity to engage in conversation, to understand why are you not being vaccinated? What's your hang up with the vaccine? You know, and to also remind people that it's not just only good for themselves, which it is, but it's also for their families and for their co-workers and for their communities. And more, I will be asking at RNAO staff meetings who has been vaccinated, because we know the ages and all that is allowed. So it needs to happen. You know, we need to be role models, and nurses the same in any practice setting need to be role models, absolutely. And I need to tell you, when they call me, my first reaction was, well, let first people in more, you know, in more critical situations be vaccinated first, because I'm working from home. They told me, get yourself back here right away. Not right away, it was for the Saturday, but you know what I mean? That doesn't hold anymore, because there is plenty of vaccines, and there will be more and more. We will have more vaccines than what we need. We know what to do with.
Thanks, Doris. Maybe Seppeline's had her hand up for a bit, so why don't we go to Seppeline, and then Irma Jean, see if there's any if there are any questions that are standing out for you.
And just for the record, 222 people listening, 222 people saying faster, faster, faster. So this is a message for the Premier and for the Minister. We want stronger and enforced public health measures to ensure no movement from region to region, to ensure no park has gatherings of people without the mask. By the way, today I heard from a colleague that of a wedding, that this individual is feeling huge pressure to go to the wedding, 150 people on the wedding, because that's what the province allows with 15%. These type of things, the province needs to stop them, because you all know, right? When you go to a wedding, you dance in a small thing. Everybody will be dancing together with mask or without mask, likely without, or at least some without. Everybody will be taking pictures. So, you know, the province needs to clamp down on these issues, because it's not helping business and it's not helping to squelch this virus. It's not helping us. Yes, Susan.
Ceppaline is next.
Yes.
I think I have my hands up inadvertently.
Oh, okay. All right. Marianne has her hand up, and then we'll go to Irma Jean.
Can't hear.
Let me see. Marianne, are you able to speak now? Okay, maybe go to Irma Jean then.
Okay, thank you, Susan. So I have just a comment here about, have you heard about any vaccine administration in schools? And if not, why might this not be done? And then just a second, while I've got the floor, someone is mentioning that a relative is working in a meat processing plant, and they have been told they won't get vaccinated until mid-May. Any comments, Doris?
Well, that is, if that's the case, first of all, if that person can connect the relative, we would never disclose the name with us, that would be fantastic, because that's insane. Let me tell you, I just put the vaccine tracker there. I believe I did.
Yeah, you did
Yep,
put
it's there.
something. Yeah.
It's the vaccine tracker, right? Did I put the right thing? I hope.
There's a password to it. Is that true?
Oh, no. Then I put the COVID thing. Okay.
Oh.
I think it's our webinar today.
Yeah, it is.
Forget it.
Okay.
Tanya, I am going to send you the vaccine tracker, please.
Okay.
And you can post it, please, for everybody. They can take it.
Absolutely.
Because then if you put it actually on the screen, I will be able to show people how it works, like how they can see what's still in the fridge. Yes.
Okay. We can put that up once I get the link.
Yes.
Okay, any comment then, Doris? Also, what were you saying about the meat processing plant?
If
person?
the person that shared can have the worker connect with me directly or to send me the memo of the record, I would never disclose who sent it to me. That will be very important, because these are the places, right, that are so problematic, because so many people that in some instances cannot even keep distance, right, because of the conditions of work. So I had not heard that they were told till mid-May, but it will be very important if they got any email or any memo, if they can send it to us. We will never, of course, share who sent it to us, but that will be very important, because that is not good news. The other thing that I need to mention that also came from a person to us, you know, they're going by postal code, but you may be living in a place, they're going by workplaces, in some to the hotspots or to the communities more in need, but you may not live there, but be working in one of those areas, right? So I think all those variations on what's happening need to be attended to. But if at the very least they would start vaccinating in these mass gatherings of people work, like large warehouses, or like food processing plants, like schools, like the communities that are vulnerable communities. If we could go on site, like the pop-up clinics did with communities in the weekend, in you know, Thorncliffe, they did a pop-up and was fantastic. If the same can happen in more and more and more communities that are in need, as well as in these workplaces that are staffed by workers that are in precarious employment, meaning no benefits, so they cannot just take off and go to vaccinate themselves, because what they need is to put food on the table for their families first.
Okay, Doris, I have another question here about any data or research associated with administration of low-dose ASA as a prevention of blood clots following the administration of AstraZeneca.
So first of all, the danger of blood clots with AstraZeneca is minimal. It's very, 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 very small. So I don't think you need any preventative thing, not that I have heard. And most people do not need to be worried. Well, most people, nobody in my view should be worried about that unless you had tons of blood clots. And even then they will tell you, don't worry about that. Speak with your primary care provider. That's my best advice to you, but no, a big broad a public health policy or a clinical practice policy of a low dose ASA. I have heard nothing about that. The danger may be more than the benefit, right?
Mm-hmm. So I have another plea from someone about a family member who has a serious life-threatening cardiac situation. They're under 39. What do we do? He notified the family doctor, who said she has no vaccines. She's contacted public health. He's flagged, but he has to go through the family doctor.
Well, then that's not good enough, right? If you can, if that person can get in touch with me and PG, put PG's address, so we will try to help through the minister's office. I'm sorry. I mean, if the family doctor has no vaccine, you know, what's the family? Well, I guess the family doctor can intervene at the public health unit, and it should. But if we can be of any help, by all means.
And then the other is the 800,000 vaccines you mentioned being in the refrigerators. Do we need to worry that they will expire?
No, no, you don't need to worry that they will expire at all. That's not my concern. My concern is that the faster we deliver the vaccines, even if we stay with nothing, because that will be the excuse, right?
Exactly.
Even if we stay with nothing, at least we did all of those and we got the system moving faster, because we will have delivered more vaccines. And by the time we will wake up, we will have 3 million in the fridge and still not the logistics in place to vaccinate everybody. So the vaccinating fast allows us several things. First of all, to reduce the stress on the system now, on ED departments and on ICUs. That's number one. Second of all, to prevent those people that will get vaccinated to get very sick. Therefore, they will not go to the ED. So that's first for them and their families. And third, it will get us to have the logistics well ironed. We still don't have them, as we can see. They delivered yesterday only 70,000 and not 100,000 because of logistical issues. So how do you fix logistics if you don't practice the logistics, right? This is not a rehearsal, guys. This is the real thing, this vaccine.
Actually, there is someone online who's asking a number of very technical questions, and I might suggest you attend the Scarborough event tonight, frankly, with the kind of questions you're asking.
Or you can leave them to the end, and if at the end we still have time, we can try to see if we can answer them.
Okay.
Bruce, do you want to continue through some of the rest of the content to make sure we've covered all of that and then come back to the questions? Okay, so
absolutely.
Stepping up the vaccination efforts, and then what's next? So do you want to talk a little bit about global vaccine equity?
Yes, and then I want to use the vaccine tracker so people can learn to use it, because it's quite fascinating and it's well done. So if you can put the slides back.
Yeah, they're
not, okay, I'm sorry about that.
They're not visible, yeah.
Okay. How's that?
Excellent. So this is nothing new. Some of you heard me months ago talk about the fact that Canada, I believe, despite the political games that are being played, ordered 8 times or whatever number of times that the number of vaccines we need, or 3 times. We have more vaccines. We have vaccines, I think, to vaccinate the entire Canadian population 3 times over the 2 doses, okay? Like us, I'm sure the US is in a similar situation, although Canada was at the head of it. The World Health Organization from the beginning has said until everybody is vaccinated, everybody that wants and can, until the world's poorest are doing as good as the world's rich, we're not safe. So it's not only that we need to do global vaccine equity for moral reasons, which should be important. We need to do global vaccine equity to reduce variants. And if not, look what's happening in Brazil. The most deadly virus at this point is the Brazilian, okay? The reality is over there is not only because of the vaccine, and I will tell you in a minute more, it's because they have a president like Mr. Trump and worse, that have said to people, do not use masks, do not get vaccinated, etc., right? And this president, Bolsonaro, is actually now fighting the few jurisdictions that decided that they will mandate masks and that people need to get vaccinated, etc. He's fighting them. The jurisdictions that did a bit of closing to try to quell the virus, because they are burying people in 3 layers, guys. In 3 layers, because they have nowhere to actually bury their own people anymore. It's a disaster, right? So Brazil is not only the issue of vaccine equity, it's also because of the politics being played. But in many other countries, it's not the politics. They don't have access to the vaccines because the rest of us have taken all the vaccines. So I do hope that as soon, if not before, as soon as the government of Canada realizes that they have given to the provinces all the vaccines that the provinces need, that no one is going to up games anymore, because these political games about, Mr. Kenny saying, and we need more supply, well, give the supplies that we have, right? And let's not get upset with Minister Hadju, with Patty Hadju, because she's giving the countdown of how many vaccines were distributed. That's a good thing. It's called accountability. And then provinces know, and we all know how many vaccines. Now we need to deliver those vaccines. But once the Prime Minister knows that they have delivered enough vaccines to vaccinate most of the people or all of the people that want to be vaccinated, let's please give those vaccines to the poor countries of this world, because their people are worth as much as ours, quite frankly. That's number one. Their people have loved ones also to care, to love, and to feed. So we need to save those lives. And in addition, until those countries are not safe, nor are we, because there will be more variants and we will never finish this. So it's critical. Now, here you have the vaccine tracker, but you need to go to another one that shows, well, go to the Ontario one. You are in the Ontario, here you go. So you can see there how many doses. There is another one that shows how many doses have been, I cannot manage it. More, go more. Here you go, here you go. If you, yes. So when you see, can you go to the next one, please? No, the previous one.
Okay, the one before?
Or maybe go to vaccine gap for a second. Go, no. Then it's and here is the note, yes, the vaccine gap. So you can see when you see the peak is when the vaccine has been delivered to us. You see, here, you see that one? Can you see my cursor?
No,
Or no?
not seeing it.
So go to the, if you go to any of those blips, that's when the vaccine was delivered. All of those peaks is when the vaccine was delivered. Here you go, vaccine distributed and vaccine administered. The difference is what's in the fridge. So now we are doing better today, right? It's 40,000, so we are doing better. Let's see what happens when we get the next one, right? So you can track that every day. And then there is a narrative also written. If you have difficulty tracking, the narrative is right there. And this is maintained every single day, guys. Okay. And yeah, it speaks about economic stability. You saw that, the previous one, Susan, still. The previous slide. You see economic and political stability. That's the Bolsonaro situation, right? So all of that is important. And we will only have economic stability when we have vaccinated most people. Otherwise, you will have what happened here. Open, close, people investing in fixing their restaurants, in fixing their stores, to only learn then that they need to be closed, right? So the time for vaccine nationalism is over. You know, we all understand that we want to protect ourselves and our own first, right? But we saw the disaster in long-term care when we did some of that, right? It's no different when you look at another country. We hardly can protect sometimes our own. Look what's happening now. The most vulnerable people in Ontario are being protected the least. In fact, there are studies already out. And if you read them, you want to cry. You feel so embarrassed and ashamed. Those communities that have the lowest per capita income, because we know by postal code and income, those communities have received so far the least access and deliverables of vaccination to this day. This is within our own Ontario. And then layer that to the world, and you can understand. If here we are seeing a spread of the virus, of the UK virus, that is, the spread is happening amongst mainly or more amongst vulnerable communities and about precarious workers, then picture that just larger scale. It's the same picture, and it brings no good to nobody. It brings moral deterioration. It brings moral rottening, in my view. So that's a message for the Prime Minister. Please, Prime Minister Trudeau, as soon as no one can play games anymore by not having enough vaccines for us, give those vaccines to those that need them more, because we need to put an end to the suffering of every single person in the planet, including us. Next one, please, Susan. So ongoing efforts that we are doing in advocacy. So you know that we are talking about the issue of stricter public health measures. I told you about that already, and reinforcing them and enforcing them. You know that we are advocating for faster, doubling, tripling the speed of vaccination ASAP, so we decrease the suffering, both at the individual level of persons, families, and communities, as well as our burdened health system suffering. So that's number one. Number two, we are saying more and peace. We have been saying this for a long time. Now we are pushing even more, including 100 for nursing homes this budget year, 100 next year. So in 5 years from now, 5 to 6 years, we can have every single nursing home with the nurse practitioner on site working for the nursing homes, because we know that they bring good to those nursing homes in terms of outcomes for residents and also in terms of outcomes for staff. That is not instead of nursing, of the long-term care nursing home basic care guarantee. That is in addition. And we are also talking about the national standards for long-term care. So that's critical, as well as for the national pharmacare. We are talking on all of them. Now, the work and well-being survey, we put the report out. So Tanya, maybe you can put the link on the website, or Imagine can put the link on the website. We are starting next week a new survey that is the Australian survey that we are doing with Nursing Now. We are running it for Canada, and it will be over 150 countries participating on that survey. It will take like 20 minutes, and we will be asking you to complete the survey once again. And we have a model. I don't know if we put the slide of the 3 surveys, but we have a, that's okay, we can do it next time. So there are 3 surveys that we are using, and this will be the last one. And with that, we will develop a program for nurses' health and well-being for Ontario, but others can use it. And it will be a program based on what you have said that is needed, that will serve us during and post-pandemic for years to come. Next one, please, Susan.
Yeah, so we're at the questions and answers. You know what I'm thinking, Doris? Is
and we sustain 219 people.
Yeah, 213. So Doris, maybe what we'll do is just kind of quickly recap the calls to action and then go back to all the
very good
answers.
Very good.
I've got a couple of detailed ones, and then I'll group some kind of themes and just ask you to speak about general topics. So you've already spoken about the strict public health measures needed, but you're urging everyone on the line right now to go beyond their networks, right?
Yes, absolutely, yes.
Okay, and this is the other piece about RNAO members speaking out, and examples of 3 of the RNAO members who have been active and sharing their voice with the media. And so we are encouraging you to consider also speaking to about your experience, right?
And I think what I will do probably in a tweet, I will put some people to follow on Twitter. Like, for example, the Gritty Nurses, follow them on Twitter. The What's Beeping in Nursing, follow them on Twitter. The 2 RNs and a dog, follow on Twitter. It's new, it's fantastic. Brigitte Umaiga, follow her on Twitter. You will, it's so much that you can learn on how to tweet, what to tweet, and how to push the agenda. And yes, tell what you see. Anita is another one that keeps saying, I'm waiting to be called. Anita, thank you for doing that. Follow these people on Twitter, because, you know, it's good that you follow RNAO, it's good that you follow me and some of us, but follow our colleagues too, because they're amazing. And the more we strengthen one another, the better it is, the stronger the voice.
Great, thanks, Doris. So it'd be great to put some of those handles in the chat box. And this is just reinforcing the need for ICU nurses, which brings to another question. Doris, there are several comments in the chat box. I think anything more that you want to reinforce about people who are wanting to get involved and how to go about getting involved?
Very good. So number 1, I mentioned to you that I did mention to government and in the media. And actually, I will put that tweet because it will be good that you retweet it, all of you, because it's good for the government to be attentive to it. The tweet on, here you go. There are a couple of tweets that it will be important to tweet. Tanya, I'm going to give them to you to put them on the chat, please.
Perfect, thanks.
I did already one. That's the one on the nurses' home care. The other one is on the issue of, I don't know if Madison is there, but the one that is on the issue of the ICU nurses. I'm sending to you, Tanya, what I want you to put. And then in terms of ICU nurses, we have been saying to government that if they need us to trigger the via nurse, absolutely let us know, because we will trigger. But I would like people now on the webinar, if they are ICU nurses, or if you know of ICU nurses, please let us know, because let them know that they either should take it to the media to say, I'm ready to work, not being called, and you can tweet about that, or at least let us know so we get a sense. Otherwise, I will wait until the government says to trigger the VIA nurse for it.
And what about students, Doris?
For ICU?
No, just getting involved. Anything more that you want to say about that?
I would say that let's first, I would love it, but we still have the 20,000 RNs in primary, RNs and RPNs and NPs in primary care and home care not being used. So I don't want to say to students, yes, come on, please, because I'm afraid they're not even using the RNs and the RPNs and the NPs. I don't want to invite you, and then you will be waiting as all the others are waiting, which is a puzzle to us.
Okay. Great.
Tanya, I did send those to you if you want to put them in the chat so people can retweet.
Yeah, I'll get that.
I already sent it. Thank you.
Doris, there's one question, I'll read it out. Is there any opportunity or role to play for the Canadian federal government with regards to forcing or obligating provinces to increase public health measures to protect more essential workers, increase vaccination programs? For example, can the feds declare a state of emergency and give orders to the provinces? I'm stunned at the degree of passing the buck and blame behavior that each level of government is saying about the other level of government.
Well, I don't think you can tell to the federal government to mandate on the provincial government, because it never has been done. And if they were to do it, they're going to get so much flack that why would they do it? Okay, so put the pressure in the media, but let's start by putting the pressure in our own home to do more than what we are doing, because if the issue is not having enough vaccine, yeah, it's the feds. But the issue now is not that, it's delivering the vaccines and is strengthening the public health measures. You know, someone tweeted yesterday in response to one of my tweets that Nova Scotia should not be getting the amount of vaccines they're getting because they're doing good. They have hardly any cases. Well, you know, my answer was the fact that they're performing fabulously because they clamped down on public health measures early on, and they knew how to talk with the public so that they didn't get enough flack. Doesn't mean that they don't need to vaccinate their people. So we are each responsible for our own pieces that we can control. And what we can control now is clamp down on public health measures until people behave and start to not gather in big places and not gather even in the park without a mask all next to the other. That's number one. And number two, let's deliver vaccines. And you have 20,000 nurses in primary care and in home care ready to do so, and their agencies ready to do so.
Great, thanks, Doris. Can you speak anything about, just talk about your understanding of where we're at in terms of the vaccine coverage with variants?
What specifically? In terms of what's the vaccine coverage with variants? Okay, yeah. Got it. So number one, I'm double tasking. I'm doing the piece that I asked Tanya, because I don't think she's
not receiving it.
I know. I'm putting them myself now. She did. I'm putting them myself. Don't worry.
Okay.
I don't think that you are able to track them for some reason. Here you go. That's one already. But I can triple task. Remember, I'm a nurse. I have the training to triple task. So the one that is most concerning is the P1. The UK variant, as far as we know, is all of the vaccines are effective with the UK variant to the full extent that they were. The P1 is the different story. That's the Brazilian one. And it appears to be that in some instances has been less effective than otherwise. And I hear similar issues with the South African variant, that people have been reinfected with the new variant. What I don't know enough, and I need to ascertain from people like David Fisman, Ashley Tweet, and others, do they get as sick? Likely the answer, I hope the answer is no, they don't get as sick. But let me tell you, when a variant is much more spreadable, you get much more people infected. The more you get more people infected, there is more chances of having again the health system completely overwhelmed. So, you know, there is two things: how much sicker you get, and the other is volume. The P1 variant, the one from Brazil, is anywhere between, I believe, 0.8 to, if I'm not wrong, 2% higher than the spread already over the UK. That is more than the classic, right? So, you know, we are in a race against time between clamping with public health measures, so we prevent the spread, if it's at all now preventable, if it's growing already, and the vaccination, so that people stop the spread and become less sick, and we get hold of this.
Great, thanks, Doris. There are quite a few questions and comments in the chat box about, you know, vaccine rollout and who's getting the vaccine first. So you've already started to answer some of those questions, but I'm wondering, what do you think might be the best place for people to go these days for the most accurate information? Do you recommend where do you think that they should be referring to, or if they have complaints, where to go with those? Because
so it depends what are the complaints. It's a very general question, but for information, it's about the vaccine tracker. I put you the vaccine tracker. It's about overall information, how we're doing. You can come to RNAO, to the website. There is always very good information. If you are in social media, follow people like Bogosh, follow people like David Fisman. I mentioned that many times. To me, my number one is David Fisman, but that's me. And the reason why is my number one, you need to know, it's not because he necessarily knows more than an Ashley Tweet or knows more than a Bogosh, but David says what he thinks. That's the difference between David and everybody else in terms of he says it as it is. Not always they like him because of that, but I think that it's a safety valve for the system. David, to me, is one of those safety valves. Similar, Dr. Brooks, that has gotten flagged. Similar, Nathan Stoll, when was the issue of long-term care. He always said what was going on without mincing words. Not always people like the style, you know, but let's get over the form and let's get to the content. Dr. David Fisman has been on the spot for every single thing that he has said. And it's to the detriment of this province that not always they have listened because the way he says the things, but I say the things pretty straightforward too. And the premier so far has put up with me, so I hope it will continue because I value the relationship, and at the end of the day, we are on this really all together. We are the fight. The enemy is COVID. It's not any epidemiologist. It's not any infection control specialist. It's not, you know, the enemy is COVID, and now are the variants of concern.
Yeah, thanks for that summary, Doris. And I just would add Jennifer Kwan, Dr. Jennifer Kwan too, and Dr.
That is correct. Jennifer Kwan for different things, for data.
Yeah.
But in terms of epidemiology and what's coming next, and so different people for different things, but very good point. Jennifer always gives you, Dr. Kwan gives you, you know, usually right after the minister, she tweets, and the minister tweets the number of new cases in the province, and how many vaccines have been provided. And Dr. Kwon adds how many people have passed away in the last 24 hours, which is very, very important because those are lives of people. And she also gives how many people in ICUs, which is critical. She even says how many of those individuals are ventilated versus not ventilated. And yes, important information. And please know that she does it in addition to seeing patients every day, right? Like this is time that people are putting spare time, whether it's Dr. Warner that is giving the accounts about what he is seeing in ICUs, whether it's David Fisman with all the work that he's doing in data, whether it is Dr. Brooks Fall, whether it is Fallsbrook, whether it is Nathan Stoll, whether it is Dr. Jennifer Kwan, all of them are putting hours and hours and hours and deserve our utmost respect for the work that they're doing. It's incredible. And another one is Maria Lab. She does excellent data. Dr. Jacob, that some of you may know, innovates. Her name escaped me in a second. In any case, I could put a list of people that we recommend to follow on Twitter and other social media. Usually these people only tweet because Twitter is where also the media and politicians look for. And the fact that they're making it all accessible to everybody that is on Twitter is really extremely important, and is a democratizing in many ways of information, right? And very important to be able to push. We try at RNAO, especially all along, I would say, but unless it's essential, and in different situations, it has been essential that we take a stand about a specific person. But in general, we try to get away from the, these personal battles, or unless things like when one of the reporters, and I will say the name because I wouldn't want to think that the Toronto Sun, all reporters are equal, but Brian Lilly took on Dr. Falls, took on David Fisman, took on Nathan Stoll. We did stand up for them, and we will continue to do that because those are individuals and others, Dr. Warner and others that have not necessarily been attacked by Brian, but those are individuals that deserve our utmost respect. And I wish the province would have listened more. If they would have listened more to Nathan Stoll that said it clearly what was going on with nursing homes, we would have saved a lot of lives, a lot of lives.
Thanks, Doris. Just switch gears a little bit and talk about being outdoors. Someone's wanting some advice about Earth Day, wanting to participate in a community cleanup, and that we're promoting exercising outside. But do you have any advice, like going ahead with something like that, that's an outdoor?
I would say masking, absolutely, even outside. My family, I have asked them to mask even outside. And I would say keeping distance, absolutely keeping distance, because you will not be only with the person or people you bubble, the 2 or 3 in your home, you will be with other people. Distance, distance, distance. And people are not careful. People are not careful about keeping distance, as some of you told me today that you saw in the parks.
Mm-hmm. Mm-hmm. So I'll ask one more question and then see what Ermagine has in her list. This one is about, well, I'll just read it. So as an RN and a Canadian citizen, I'm saddened by the recent spurred deaths of women due to domestic violence. And suggesting that this might be a result of the health restrictions. And as nurses, what can we do about advocating for this? Could there be a cell phone app like an Amber Alert?
Excellent, excellent. Absolutely, yes. And also child violence or violence against children. I absolutely think that those public health nurses that know of situations, or primary care providers that know of situations, they should keep in touch we should keep in touch with our friends and relatives, right? At least, and even if there is no violence, to see how are things going. We all know the number of people that are feeling down by what's going on, right? Let's keep in touch with people, because this is a time of need. This is a time of reaching out. And this is a time, I want to say, of not reaching only in and staying alone if you feel that you are yourself in a situation that is compromising your health. Reach out. I know for some people it's very difficult, but it's critical that we reach out to one another, and that when we are in need, we reach out too. I know that is the case. Someone also has a question about news on vaccination children 15 and under, from 12 actually it will be. Pfizer already has well advanced testing on children 12 and others. My hunch is Moderna will be similar, and then we may see others. I have a sense that by September, children will begin to be vaccinated or will start to be vaccinated before the school opens. That's, I don't have nothing secure on that. This is a hunch from what I read, but I do endeavor to check the situation with people like David, Ashley, and others, and get back to you on that.
Thanks, Doris. Irma Jean, do you have any?
Yes, and I'll go back to the vaccine questions. There is one question here about, are you aware of any special kinds of facilities for vulnerable persons who may be disabled and unable to stand in lineups, those with bowel and bladder disease, etc., who find this really not something they can tolerate?
Yeah, so what we are recommending with that is the home care nurse, right? I mean, there are so many home care nurses, and I have spoken with Shirley Sharkey, I have spoken with Janet Danglish, and I know Bayshore, BON, and St. Felice, and I'm sure BHA and all the others are so ready, imagine, so ready to step in and to do exactly what you're saying, and others are asking, to go to the homes, to vaccinate people, to do smaller clinics that you don't need to stand in line for a long time, right?
And there's a question here. What is the data on current death and morbidity rates from those who have been vaccinated? Is there any data?
I know that they were trying to look here in Canada, but there is data from other countries. First of all, the rate of reinfection in Israel from the UK variant is 0. Not so it appears with the South African one. It appears that there are now signs of reinfection with South African one. And I haven't seen, but again, that's one of those questions, Susan, you can keep for me to ask in terms of mortality more than anything.
Yeah.
Probably very low, imagine, very, very low likely.
Yeah, for mortality.
So far, with the variants we have. This is why I'm saying we have a race against time, because tomorrow can be another mutation that is even more brutal than the P1.
And
in fact, in Brazil, they're already looking at one, imagine. The P1 plus 18 additional mutations, I believe. I sent it to a couple of epidemiologists. The answer was, I'm losing track of it, because there are so many mutations. But trust me, they are all very well connected, and they work with people from all over the world, and I trust them with my hand in the fire. This is why I think it's so critical that our premier listens attentively to the science table. All these individuals are the individuals informing the science table. And again, this was preventable, what we are seeing in ICUs, if we had clamped down on public health measures much earlier, likely 2-3 weeks before, if not 4. Instead, we relaxed them, remember?
Yeah.
So the science table is there, the modeling is there to prevent a disaster, not to alert us to how bad the disaster will be because we allow it to happen.
Yeah. So there's one more question here I have, Susan, that seems to be right up RNAO's pathway. Is there a mechanism by which we can write to our member of provincial legislature to boost our say in enhancing the logistics of getting more people vaccinated? Does RNAO have such a form letter?
So number one, thank you for asking, because this is exactly where we need to go now, into the tripling the vaccination. And I don't know if Matt is online, but if not, Imagine you can talk with
Yes.
Matt to prepare an
The
action
action
alert.
alert?
An action alert on 20,000 nurses are ready to go with primary care and home care. Their agencies are ready. Give them the supplies so they can get on with the job and vaccinate. And we need to say where. Vaccinate the people in vulnerable communities. Vaccinate the people in warehouses and food processing plant. Vaccinated people in teachers in schools, etc., etc., etc. And also vaccinate your own, like home care nurses are not vaccinated. I don't want to say it again and again, but it's true.
Yeah, because a number of people have commented on the fact that nurses are not
Well, the
vaccinated.
primary care nurses have been vaccinated, I believe. All of them, in fact, even in January, February, they were vaccinated, not so the home care nurses.
Yeah. And somebody needs another boost here, Doris. They said, I was under the impression nurses were not allowed to speak to media. Is that correct?
Well,
correct.
Very good question, because somehow years ago, there was a directive from the college about this. What we are saying to nurses is speak, speak, speak. Never say who is your employer, because for that you need to ask permission from the employer. And never say a name of a patient. If you have watched, and Susan, maybe you can put the clip from Dr. Warner, where everybody knows, by the way, where he works, right? I mean, it's not difficult to find for a doctor where he works, but he speaks with detail about patients without their name, with the permission of patients. I'm not saying that you speak specifically about, with all the details that they can identify your patient, but you can say, I took care of a woman today in the early whatever. And, I mean, this is how the issue of a teacher being intubated got out, because people started to talk. The issue is we are not allowing the media in. In many countries, they allow the media in ICUs because that scares people and they start to take more serious action for their families and themselves. Here, we are not allowing the media to go to ICUs. If only doctors speak about what's going on, let's not be surprised that nursing then, no one can do something to you if you do not disclose the name of your employer, because if you do, you need to ask permission. And some of you may want to ask permission and be spokespersons for your place, but that's up to you. And no one can tell you this is democracy. Look at Brigitte, look at others, look at the gritty nurses, look at the Deb Lefevre and others that are, they all work.
I also add to that, Doris, that when people are speaking to the media, that they identify that they are a registered nurse or nurse practitioner. I see.
Please do, and more even, excuse me.
Yeah.
Look at Brigitte. I'm sorry, I need to say it, always with her pin. She makes me feel so proud.
Yes.
Look at Deb from the Ontarians and a dog, always with her pin. I feel like, someone called me on the vaccine Big Mama. Ola called me Big Mama. Thank you, Ola. I love being a big mama. Imagine, Susan, we all want to be big mamas. Make us feel big mamas because you wear the pin.
Yes, I just put mine on. And Doris, I have one more question about the you mentioned there are many, many vaccines or will be. Can you make a comment on the issue of the 4-month spread between the first and second dose? And should we be advocating for some change in that?
So number one, I think that will change in itself probably in June, when a lot of the first dose has happened. Is it ideal, the 4 months? If you are older than 60, it's not ideal, but still you are covered. Just the older you get, you are less covered with 1 dose than, you know, but you are not covered if you have no dose. Mm-hmm. And what we are trying now is to have less people becoming infected. And for that, you need to spread the 1 dose. So RNAO is in total agreement. I believe that come end of July, everybody will get the 2nd dose, you know? So I think hanging there, no, it's not something we will push now because it will not serve the collective good to have 2 doses on only some people, and then not to have except of what happened in nursing homes. We did give the 2 doses because those people are 80 plus, right? And very vulnerable, very sick, not sick, but complex, right?
Yeah. There are a couple of people.
But just so you know, in the younger generation, it's super effective, even the first dose. Super, like, you know, over 60%, I believe. We may want to invite for the next one, Susan, either David or Ashley or Dr. Tweed or Dr. Fisman or we may want to invite an epidemiologist or an infection control, Dr. Bogosh, one of them to really speak about the effectiveness of the vaccine, very specific and about the, but I think you will hear similar, that for the great majority of the population, the 1 dose is hugely already effective. And what we are trying is to do more breadth to have less people infected, and then the depth of those that are more at risk, 70 and plus.
Yeah, great. There's a couple of people letting us know in the chat that schools that remain closed after the spring break, it was just announced by the Premier.
I knew it would be. Sorry, I believe it's only Toronto, not all over. Is it all over?
Maybe Connie, you could let us know.
It's only Toronto, and this is Dr. Eileen De Villa using her powers. I believe, Minister Lichi.
All over.
Oh, is it?
Ontario, yeah.
Very good.
Morgan.
Very good.
Province, so.
Very good, because Minister Lichi had said in the morning that no. Okay, good. I'm glad to hear that. I'm not glad. You know what I mean? No. As a nurse, I'm not glad that schools are closed. Kids need schools. All of us that have kids or grandkids know that kids need school. They love school. Parents need school for their own sanity. And some kids need school because the situation in their homes is unsustainable otherwise. But at this point, with teachers not being vaccinated, with only a small percentage of the population overall not being or only a small percentage being vaccinated, it's not the time to reopen schools. We're not even there.
Yeah, no, that's tough news on many levels. Doris, there's a question about, do you know if vaccine sites are offering sign language interpretation for individuals that need that support? Have you heard of that?
No, I don't. Let's ask about that, please.
Yeah.
I have no problem asking Dr. De Villa directly or someone in her office. Yeah.
Yeah. Do you have any thoughts on what our members can do or what we can do to support some people who are having difficulty access? Is there anything more that you think that people can do?
So number one, action alerts, sign action alerts, get into Twitter. You need to think this and then this. So macro about policies and practices to reach the public, stay at home. We can put that one that I have, you know, that one that says stay at home, go out only for essential services, for essential needs. We can put it in the website, ask Marian, that people can borrow and use. We don't need to ask permission from government. Everybody, including me, are using it in the media all the time. So people can use it to send a message to Ontarians and say why, for your own health, for your family's health, for your community's health, and for the health system's health. And we can put even a message. Maybe we can ask Marian to work with Alfred and use that black one because it's the one that the minister uses, and just add from RNAO that for your own health, etc., etc. Second, to push government for enforcement of the public health measures, up and including curfew if we continue to see gatherings that are inappropriate. Thirdly, this issue of weddings that can be 15% or 20%, I don't care what it is, it should be 0% close. Because people dance together, get pictures together, that is a facade.
Should we be reporting that if we hear about it?
No, I don't want to report it because I heard it from someone I know. And because if it's on one situation, it's allowed by the government, I was told. So we need to report to the government to stop that. Thirdly, now at the meso level of your community being your street or your church or your mosque, please, Ramadan is starting tomorrow, guys. No family gatherings eating together. Same as we said for Passover, same as we said for Easter. Please, 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 let's be careful, because if not, we don't know how we will come out of it. And then comes and do the services online. Do the services online. They were allowed to remain open. We should move online only. So again, that's something to put in our action alert, Imagine. And then at the personal level, your street, if you know someone lives alone, and if you know they cannot get the grocery, or if you know they cannot go to get the vaccine, soon home care will be delivering vaccines. I'm quite confident because of our push. Once they finish filling out a 18-page document or whatever it is that is out of this world. Help them, because they may not have the language, they may not know how to book themselves. Just give them a call and help. You know, the old fashion of calling, how are you doing? How can we help you? But don't start to take in your car someone else. You know, it's very close proximity. It makes me very nervous. Just arrange for them to go, unless that is, we can arrange for a bus or something that is more distance, right?
Okay, I just saw a couple of other questions that I didn't notice before, so I'll ask you those. And then it's 3:30. I'm not sure where you want to go for the rest of the webinar, but just a question about HIPAA privacy laws, and is it acceptable to ask people if they're vaccinated?
Well, you can ask, they may not answer to you. I mean, be sensitive, right? The question is, for what are you asking? If you are asking because then you can sit and have dinner together, you should be taking care of yourself anyways. Being vaccinated does not mean you don't keep social distance, you don't do this, you don't do that. Remember, one dose is not full proof that you're not getting or passing the virus. It's a proof, hopefully, that you don't end up in an ICU or worse, right? So you need to be careful, 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 even after that dose. So the question then is, why are you asking, right? Right?
Yeah, good point. Another question, why?
No, the RNA, mRNA does not change genetics, period. Not whatsoever, does not change the DNA, please. Does not change the DNA at all, okay? So for the person asking, please know
Yeah,
that.
and I put in the chat box a reminder of some of the other webinars that we've had, like the one with Dr. Cora Constantinescu. She addressed a lot of these issues and went into a lot of detail.
Excellent.
Yeah, so I'd refer you.
And also Susan, the
Yeah.
interview with her, and ask Marianne, please, to put that interview not behind the wall of RNAO. It's right now, it's just for members. I would ask her that I ask to release that to everybody.
Okay.
Only that article, not the whole RNJ.
Okay, great. And also on our COVID portal, the immunization section, we have a lot of great resources and a link to the Center for Effective Practice that gets into a lot more detail, technical detail about vaccines. So I'd refer you to that as well, to some of those questions.
And just so you know, we are members working with that center. We are in their advisory, and we do work with them on any single piece of material coming out.
Okay, a question about why are there no pop-up COVID hospitals if the ERs and ICU?
There are many now. Here is the disaster here is where the fiasco of the policy failure doesn't even have a good face to it. We were building these pop-up hospitals at the same time that we were relaxing the public health measures. So it tells you that this province knew that things will get worse. This is why I keep saying this has been a failure by design. It has not been a mistake. It has not been a we didn't know. It has been a failure by design. We were building these field hospitals at the same time as the public health measures were being relaxed rather than tightened. And every day counts. Every day counts. A week before this more serious stay-at-home order, we had the slowdown, or as I call it, the no-down. A week before was nothing. And a week before that, we had relaxed things. So yes, there are field hospitals. And not only that, there are 9 adults hospitalized in an ICU in sick kids. So we are in a serious situation, guys, very serious. And it will be worse tomorrow and for the next few days because this is the result of the Easter weekend. Right? So then we will start hopefully to see a bit of a slowdown unless P1 starts to take over, and then I don't know enough to tell you how you stop it short of a complete lockdown with no movement between anything, only going out with a permit, as they did in Chile, by the way. You needed to call and get a permit to go out even to the pharmacy. You could go out only twice a day, only for a short amount of time, and massive vaccination like we are not seeing at this point, at least.
Hermigene, is there anything else on your list that's standing out that?
Well, there's one question here about contact tracing, and that from the experience of the participant, it seems that public health units are not engaging in contact tracing, and that the individual who is tested positive is being asked to identify the contacts themselves and let them know that they are positive and what they should do. And the questioner is saying, does that sound right? Can we do anything about this?
Yeah, so I don't want to speculate if it's one person that this happened or it's a lot. I can do homework. I can tell you though that we know now by postal code where most, right, and by who is in ICU, where most of the burden of COVID is happening, and hence why we should go there ASAP before we even do any contact tracing and vaccinate. That's number one. And number two, I had not heard except of during holidays and inconsistent between one public health unit and another of how much during weekends and holidays they do contact tracing. So I can certainly do more homework on that. And then there is the issue of human resources, right?
I had heard myself that some of the public health units are so overwhelmed, they're way behind in getting back, and their request to people is if you don't hear, you could assume you're positive, make sure you tell people that you are possibly positive.
Yeah, here you go. And so it varies between units and units. I do need to say hi to Patricia Stiles. Trish, 29th of October. I tried to send you a happy birthday message. We have birthday at the same time. And I couldn't find you an email. Send me an email, please. You change email because you're retired. You have no right to retire. Okay, now I can get on. I just saw her name. Okay, who is next?
Here, someone is saying public health units are doing contact tracing 7 days a week, some. So yes.
Some, I know.
Yeah.
And Rhonda's saying that different public health units are managing contract tracing differently.
We know, yeah.
Okay.
Yeah, and I don't want to specify because I know where what. I just don't,
Sure. Okay, so Doris, it's 3:42. You've answered most of the themes of the questions. I think we could probably have questions trickling in, really specific ones, but I think you've answered a lot of the main topics today. So I'm wondering how you would like to, if you want to close the webinar, if there's any other things that you want to do before.
So I know that there was a colleague, I just want to close the loop, that had other technical questions. You can either send me those technical questions, and if I have answers, I will respond. If not, I will get the answers or put it in touch with someone that has the answers. Because I don't want to overstep what I know and don't know. I have a epidemiologist and infection control specialist with whom I consult when I don't have an answer. So by all means, so that's number one. Number two, get onto Twitter. If you need a session, let's ask here, how many of you feel that you need a session next time or even before, or that you need us to send how to download tweet and for you to take on to Twitter, to either put pressure, to retweet, to ask, and to support. Like yesterday when Toronto East was in Thorncliffe doing a pop-up clinic and doing amazing work, I just was cheering up, right? Cheering up. We need to cheer up when it's well-deserved, because people are trying to work very hard. It's just that we need to work hard and smart, right? So ensure that the logistics are there, ensure that when you hear an outcry of 20,000 RNs and RPNs and NPs that work in primary care, in family health teams, in community health centers, in NP-led clinics, AIACs, and when you hear all the nursing, all the home care agencies saying we are ready with our nurses to go and vaccinate, that we take them on and we free them up to do the vaccination that is so desperately needed, because as I said, we will get more and more vaccines. That's not my concern. We will get more vaccines than what we know what to do with. So the sooner the logistics are fully freed up to do what needs to happen. It reminds me of another thing that WHO said long ago. This virus is faster than us, and this was before the COVID variants. This virus doesn't go to sleep, doesn't take a break, doesn't take a holiday, doesn't take vacation, not a Saturday, not a Sunday. The variants and the COVID itself are there to find who will host them next. That's simple. They are not, this virus is not there to kill you or a family member or our communities or any of it. It's there to find the host so that the virus can spread. That's the job of viruses. And we need to be 3 steps ahead of the game, and we are 3 steps behind the game. As simple as that. 3 steps ahead of the game means each one of us listening attentively ourselves and serving as role models. Second step of the game means the government using all the public health tools that has at its disposal to clamp down movement of people up and including complete curfew if need be. Third, vaccinate at 3 times the rate, 24/7, because quite frankly, some people would prefer to go at 3 a.m. That would have included me, when there is less people that are there than going in the middle of the day or like going in a lineup and being waiting for whatever. So that's the recipe here. And then we will laugh at the virus instead of the virus laughing at us. And that's where we want to be. And to protect our workers, whether it's workers in, the warehouses or that need to travel 2 hours in a bus, or whether it's our own colleagues, the nurses that are in the ICUs today, those dogs that are exhausted, the intensivists in the ICUs today, the artists in the ICU today, the cleaners in the ICUs today, they are exhausted, guys. So we need to slow this down, and we need to finish it once and for all. And that will be the next piece I started to write yesterday. We will be pushing for COVID-0. We started to push last August. We were not listened to, and many others, Dr. Morris started it, and others, if we had listened back then, we would be in a better shape today. We will push again to that, because if not, we will be back at it with the 4th and the 5th wave. There is no magic. There is no magic, but we know what to do.
Great, thank you, Doris. So I think that maybe brings us to a close. We'll post this recording on our website, and our next webinar will be Monday, May 10th, same time, same place. So we look forward to continuing the conversation.
And if people feel that we need to do it more often, let us know and we will consider that. We do have, you want to remind people when is the webinar on the Black Nurses Task Force, please, for a sec. And also, I think we have another one that is important. Here you go, fantastic. So that is next week, right? Next Monday.
Next Monday.
And it's worth attending. It's fabulous. It's fabulous. Corsit and Angela do a fantastic job facilitating this webinar. It's absolutely excellent. Thank you, everybody. And here is the other one. This is amazing too, with our knowledge keepers. Absolutely excellent on April 20th. Thank you. And the NP Institute with Frank Morocco, who is, as you know, the LTC Chief Commissioner. He is there. Matt Anderson, the head of Ontario Health, is there. Shirley Sharkey and Wendy, imagine knows Wendy, the nurse practitioner. She's fantastic, and several other people. It's a fantastic day for those of you that are nurse practitioners, but we are going to open the session with Frank Morocco to everybody. And I don't recall exactly when is that session, but stay tuned, we will feature that. Okay, take care, everybody. Thank you.
Thank you. Bye-bye.
Bye-bye.